Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Good afternoon. I am Dr. Surendra Prasad, and welcome to another episode of Health for Life. Health for Life is a program designed to inform the public about common medical issues. Today, we will be discussing vaccinations. My guest physician today is Dr. Karen Butters. Dr. Butters is a well-known general practitioner who has been in private practice for over 5 years and currently has an extensive pediatric practice. Now, I want to get into this special topic on vaccinations, and that is HIV vaccinations. We've got Joseph from Vigilance, who's gotten a question here about on WhatsApp. He says, why are babies who are exposed, now I don't think exposed is the correct word, but why are babies who are exposed to HIV not given BCG vaccine? First, make the correction to what he's asking, because it's not exposed, I think it's infected with HIV.
Okay.
And then talk about HIV and BCG, and then we'll talk about HIV and vaccinations in general.
Okay. The HIV exposed babies, they are exposed at first. Mm-hmm. That's as a neonate, mommy has the infection, baby is exposed. Okay. We will know whether baby is infected or not the later date after we do the DBS at 6 weeks, and then it's repeated at 3 months too. So if it comes back positive, and then we do the ELISA test at 18 months. Once that is positive, well, then the baby is infected.
Okay.
Before that time, the baby is termed exposed.
Okay.
An exposed baby and or an infected baby is not given BCG because BCG is a live vaccine. And there is a risk that the baby might progress, the disease might progress into disseminated TB. So we do not give the BCG to the exposed babies until we do the ELISA test at 18 months and they are negative. Okay. Then the exposed babies get, the infected babies do not get BCG at all.
So you've got a situation, and Dr. Roberts did talk about the success we've had in Guyana in almost reducing the transmission from the mother to the child. Yeah. I think we can say we can almost reduce that to zero.
Yeah.
So you've got a baby who's born to an HIV positive mother. The child by definition has been exposed. We've done all the precautions. So until you are sure, based upon testing, that the child hasn't become infected, you're going to wait and not give the BCG because it's a live vaccine.
The yellow fever also, we do not give to the exposed babies until 18 months.
And if at the end of the 18 months you're now showing that the child was exposed but not infected, then you go ahead and give the vaccine. But if the child is infected, then you cannot give the vaccine.
That's the regulation. The other vaccines in the exposed baby and the HIV vaccine and the HIV infected child, they are given. Okay. The DPT, the hepatitis, those are given.
Now you mentioned yellow fever, and we've got Arifa from Parfait who's asking a question about yellow fever vaccination in babies. What is, in Guyana, what are we doing with that?
The yellow fever vaccine is given at 1 year or anytime after 1 year. Okay. You could, because it's usually potent for about 10 years, you could actually give a booster when the child is 11.
Okay. Now, we've got Joy from South Rumvelt is asking about various things. She's asking, can you apply iodine to the infection site?
There is no need for iodine. If the vaccine has been given with the sterile needle and under sterile conditions, there's no need for iodine. Okay. Basically, all you need is a cold compress.
Now, on the table here, we've got some documents which you've brought, and I'd like to start with this one. This one is titled the National Reference EPI Manual. Now, this here is Guyana 2012 Ministry of Health PAHO. Explain to us what this book is.
This book gives us all the a list of all the vaccines. It tells us the diseases that the vaccines prevent. It gives you a little history of the diseases also, and it also gives you like the cold storage. It tells you almost everything about what you should know about giving a vaccine, and a health personnel's manual for vaccines. How you give it, where to give it, how you store it, what to expect after a vaccine is given, the ages at which the vaccines are given, and the Guyana schedule is in the National Reference EPI manual.
So this document is a WHO document, but in addition to having the broad regulations or the broad recommendations, it also gets into specific recommendations. Yes. And every healthcare provider or worker who's involved in the vaccination program should have this. Yes. And it is the basic protocol that everyone is following. Yeah. Then we've got these two, and I see they're nicely color-coded, so not hard to guess as to one's got to be for the boys and one's got to be for the girls.
Guess which one is for the girls.
Having a daughter, I decided it's easy to know. So I'll pick on this one. So this here, it says the take-home record. So it's pretty clear what this is. So this here is the Child Health Take-Home Record. And so this is a Ministry of Health document.
Yes.
And I believe every child in Guyana
should have
one.
We call it the passport, the child's passport.
The child's passport. But tell me, not only is vaccinations in here, there are other stuff in here.
Yes, it gives you feeding recommendations for the babies and for the children as they grow. It also gives you the weight for height, the height for age, and you map those and to see how the child's demographic data corresponds with the national data.
Right, because I think people always have a challenge understanding the various charts, but they are charts based upon the child's height, the child's weight, in the infants, the head circumference, and we know what the targets should be and how that should go with time. So it's very important for persons to become familiar. Now this one says the take-home record, and this one says the clinic record.
Yes, that stays in the clinic.
Okay.
All the parameters are recorded in the book for both mommy to take home and for the clinic to have their record. And it's quite useful because just in case something happens and they've lost their record or misplaced it, we have our records so we can just go ahead and replace.
Yeah. I think parents recognize how important it is to have this. And I would assume that for school, both private school and public school, having this is a requirement. You have to take this in.
Yes, you should.
You should take it in.
And it's one thing to say that the parents or caregivers should take care of that passport.
Okay. Now, you dealt with this question, but Anthony from Eccles is asking again about vaccinations and the concern that some parents have. Oh my, look at this long list of vaccinations. Is my child's immune system going to get overloaded?
No, in no way it's going to be overloaded. The amount of the weakened form of the vaccine or the part of the virus or the bacteria that is given is so minute that the body is able to respond to that. The body is able to build on that with the antibodies. And even though the child is given multiple doses, and that's just 2, 4, and 6 months, and also the reminder at 18 months, the boosters, the body's system is in such a way that it would not become overloaded. Just think about the amount of viruses and bacteria that your child is exposed to on a daily basis, at home, anywhere they go.
Correct.
And there are millions and millions of germs that they're surrounded. That little bit that we give is actually to help them to fight off these infections. Yeah.
So people need to recognize that we are all exposed to various bugs and bacteria and viruses, and our immune system is developing every day. And this is just meant to help with those specific ones, which we know are very dangerous. Now, we've talked mostly about the vaccinations and the infants and the babies. Now, there has been a lot of discussion recently about human papillomavirus. and the development of vaccinations for both, I think, initially started for girls, and now there's a suggestion that we should give it for boys. Let's take a step back and talk about human papillomavirus and what is the concern we have about human papillomavirus and a specific disease. So let's talk about that.
All right. The human papillomavirus is the virus that is, what should I say? It's the virus that causes, or is known to cause, cancer of the cervix. The age for human papillomavirus vaccine is actually from girls from 9 years and over. The HIV infected children or infected girls, we try to vaccinate them with the HPV virus vaccine. And we're actually admonishing all young ladies, all teenagers, to become vaccinated with the HPV. It is not such a big thing in Guyana, but in the States, the HPV vaccine is really widespread.
Yeah. So human papillomavirus is not one virus. It's a number of viruses. And the big concern is that I believe worldwide the number one cancer killer among women is cervical cancer. And I do believe that is true in Guyana too. And so I think we need to make sure persons understand what we're talking about is giving a human papillomavirus. It's a virus. And that virus, some of the subtypes cause cervical cancer. So if we can give a child
something to protect them,
they will develop the antibodies for that, and it will reduce their risk of developing cervical cancer. Because there's been a lot of discussion, and I think when we deal with issues of human sexuality in Guyana, people get very protective. And so when you talk about cervical cancer and a virus, people get a little concerned, well, are you talking about a sexually transmitted disease, etc.? But I think, one, it is not mandatory in Guyana. Is that correct?
It's advisable, though.
But as you have said, it's highly advisable. And I think it is very important for all parents to read about this. Now, right now in Guyana, is the recommendation for both boys and girls, or we're...
For girls so far.
Primarily for girls. And the ideal age, you said, is...
9 and above.
9 and above. So it is not that we're saying the child is sexually active at 9, but you need to give it at this age so that the body develops it.